Introduction to Long-Term Care 2.0 Services. We will provide information about Long-Term Care 2.0 today. As we get older, we might require help with everyday tasks like getting dressed, taking a shower, or moving around. Long-Term Care 2.0 services can offer a helping hand when family members are overburdened with caregiving duties. But who is eligible to apply for Long-Term Care 2.0 services? Let's find out. First, let's talk about the eligibility criteria. Individuals must be assessed by the Long-Term Care Management Center of each county or city and rated as having a disability level of 2 or higher. In addition, applicants must meet one of the following conditions: be an elderly person over 65, an indigenous person over 55, a person over 50 with dementia, or a person of any age with physical or mental disabilities.
How do we know what disability level our family member falls under?
If you need to apply for Long-Term Care 2.0 services, simply visit your local care management center or call the Long-Term Care Hotline at 1966. The center will send a care manager to your home to conduct an evaluation. The evaluation will focus on the physical, mental, and social functions of the individual. The care manager will use 2 assessment scales: Activities of Daily Living, ADLs, and Instrumental Activities of Daily Living, IADLs. They will also consider factors such as the individual's awareness, nutritional status, medical history, and living environment before assigning a disability level.
I see. Will we be able to access the services after the care manager determines our level?
There's just a little more to it. After the evaluation, if you meet the eligibility criteria, you will be granted a long-term care budget. This will indicate the service payment amounts for disability levels 1 to 8. The subsidy amount varies for each level. The higher the disability level, the higher the subsidy. Subsidies are also adjusted based on financial status. Low-income households receive full government subsidies. Middle to low-income households pay 5% to 10% out of pocket, and regular households pay 16% to 30%.
Can we use all the services provided under Long-Term Care 2.0?
Not quite. An assigned care manager from the Long-Term Care A unit will meet with you to go over your options for services and to create a personalized care plan. Your family will collaborate with an A unit case manager to schedule the services, times, and requirements. Of course, the care plan can be modified if your needs for long-term care change while it is being carried out.
I see. Once we have the plan, we can access Long-Term Care 2.0 services.
Exactly. If you have any questions about the services, you can always reach out to the case manager from the A unit to make adjustments. This concludes the introduction to Long-Term Care 2.0. If anything is unclear, you can call the Long-Term Care Service hotline at 1966. The hotline operates Monday to Friday from 8 a.m. to 12 p.m. and 1:30 p.m. to 5:30 p.m., with the first 5 minutes of the call free of charge. Feel free to inquire if you need assistance.